If he cautions, is my scene safe?
Scene is safe.
What's my dispatch?
You are dispatched to the residence of a 25-year-old male complaining of stab wounds.
Stab wounds? Okay.
Just one stab wound.
Just one stab wound?
Yeah.
Alright, I'm gonna consider this an MOI. Is this my only patient?
Yeah.
Okay. I'm gonna consider C-spine. And I'm gonna also request additional ALS. I now get my general impression. What's going on, sir?
You find your 25-year-old male patient lying on the floor, complaining. No, he's conscious. He's hurting. He's just really mad.
What's his chief complaint?
His chief complaint is abdominal pain.
Abdominal pain? Alright. Okay, alright. And then I go.
Yeah.
I'm gonna break off.
And keep going.
Okay. Alright, I'm gonna take ABCs. Is the airway clear?
Airway's clear.
Okay. I'm alright. Gonna have my can you get a respiratory rate? And what's the quality of this breathing?
Breathing is rapid and shallow with a rate of 27.
27.
Lung sounds are clear.
Okay. I'm gonna also have my EMT start bagging the patient because it's more than 24. Thank you. And then I'm gonna now take circulation and get a radio pulse.
His pulse is 174.
174. Okay. And then what is the skin tone?
Pale, cool, and diaphoretic.
Okay, sorry. And is there any major bleeding?
Yes. In his abdomen and his head.
Abdomen and head. Okay. I'm going to immediately apply dressings, and what do I see?
The knife is on the left side of his abdomen, upper left quadrant. Yeah.
Okay, I'm gonna surround the knife basically, and then also, is it on the back of his head?
Yes.
What's that? And then I'm gonna have my EMT hold C-spine as I. I guess you don't have to hold C-spine because she's doing that, and she'll be holding C-spine. And then I'm going to make this a priority patient and transport them as soon as possible. And I'm going to retake vitals, blood pressure, etc.
ALS is 10 minutes out.
ALS is. And
Yep.
what's his blood pressure?
His blood pressure is 68/42.
68/42. What's his blood glucose?
His blood glucose is 100.
100. Okay. And then what's his temperature?
His temperature is 86.
86.
100.
Alright, I'm going to now do my head to toe assessment.
Ow, that hurts.
Okay. Is there any CSF?
No, there's no cerebrospinal fluid.
Eyes?
They're good.
Okay, and then any facial, like
Nope.
throat breaking? Okay. Have you hold C-spine? I guess you want to check the back of the neck.
Good.
Okay, and then is the trachea midline?
Yes. No distended jugular veins.
Alright, and then I'm going to now check the clavicles.
They're good.
Okay, and then sternum,
Good.
chest, ribs.
That hurts.
That hurts.
Yeah.
Obviously, abdominal.
Yeah, it hurts a lot.
Okay.
You notice contusions.
Bruises. Okay. Alright, and then I'm going to check for crowd.
He's good.
And hips.
His hips are fine.
Okay. Legs.
You don't notice any deformities.
And what about CMS?
CMS is good. You're good? CMS is good.
Okay, that's first.
And then I'll check the upper extremities now.
You don't notice any decap BTLS.
CMS.
CMS is good. There's a radial pulse. CMS is good. You don't notice anything.
Alright. And then, is he still, how bad is he bleeding?
A lot.
Well, like, are the dressings working or no?
No, they've bled through.
Like blood through? And another one for the back of the head. And then I'm going to rapid transport.
Okay.
And he's alert, right?
Yes.
So I'm going to ask for any allergies and medications, etc.
He doesn't have any allergies. He didn't take any medications.
What about his I guess the really past history doesn't really matter.
No, he doesn't have a past history.
Okay, and then what do you last time?
He was making himself a salad.
Okay, and then what happened? What happened?
So he accidentally dropped the knife, tripped over his dog, landed on the knife, and hit his head on the counter.
And he remembers all that? Okay. You got that right now? Okay.
He has a photographic memory. It's fine.
And then now he's a priority patient, so I'm going to retake vitals every 5 minutes and transport when
All right, perfect. ALS is here.
Alright, I have a 25-year-old male with a chief complaint of a stab wound, and when we arrived he was lying on the floor conscious, but he was angry and he was complaining of abdominal pain, and he also hit his head. When I revealed he was bleeding from his head, and then he also had a knife stuck into his upper right abdominal. And his respiratory rate is 27 with low and shallow breaths, so we're BVMing. We used the BVM with hypoxia. And the pulse was 174, and he was pale, cool, diaphoretic. And we took care of the bleeding, and we made him a priority patient, and his blood pressure was 68/42 with a blood glucose of 100. His temperature was 86, so I treated for shock and gave him a blanket, etc. His jugular veins were non-distended, and his trachea was midline. He had rib pain upon palpation and abs, and he had bruises, and his epidermolysis. Okay. And then while I'm going to do this, I'm going to check for the back as well. Can you also just help me see spine?
Make sure to video already happened out before.
And then what do I notice?
You notice the
I think the patient was sitting.
yes, and contusions.
Contusions. I'm gonna dress the back of the wound as well. Okay, and then one second. Okay, and then we're waiting for rapid transfer, and he has no allergies or medications. And he was making a salad, and he tripped and fell on his dog. Landed on the knife and hit his head on the counter.
Okay, perfect.